Now sending it over to Saray.
Thank you, Nisha. February is Cancer Prevention Month, a time to focus on the best strategies for not only treating cancer, but trying to prevent it in the first place. Joining me now for the sponsored segment is Dr. Christopher Valentine, a medical director for Optum. Welcome.
Well, thank you.
So what are the challenges that patients face when they come to you with a diagnosis like that?
Well, really, a lot of what we try to focus on is just understanding ways that we can prevent this kind of conversation in the first place. But to answer your question, we really try to understand what their needs are, what kind of resources they have, and ensure that they're connected with the right supports, not only medically, but also socially and in their lifestyle as well. And
with a diagnosis, there comes along treatment, too. I'm sure you have to walk them through what happens next.
Well, when you're approaching some patients with these kinds of challenges, you want to make sure that they, again, are connected with the right kinds of specialists. But really the first thing that we want to do with all patients is ensuring that they have the right kind of prevention.
And Cancer Prevention Month here in February, what is your main message that you would like to tell folks right now?
I'd say the two main things is just understanding that there are things that we can do in order to reduce our risk. There are things that we can do in our own lifestyle to try to eat in a healthy way. We can reduce our risk for colon cancer by having more fiber in our diet and avoiding alcohol. We can also, the second point is just reducing our risk by catching these sorts of things really early through proper screening. And there's a lot of things we can actively do to catch these things early.
And Dr. Valentine, we were just discussing an article that I was reading with older women of not screening because of cervical cancer on the rise.
Right, right.
What would you like to tell people when it comes to screening? People can get lackadaisical, maybe put it off a little bit.
Yeah.
What would you tell them?
I would say that really it's important to understand, based on your age, your individual risk factors, what are the types of screenings that we need to do. You know, whether it's mammography to reduce the risk for breast cancer. So, for example, that's one of the things that we at Optum do is we try to make it easier for people to do it because we're all very busy. We have an Optum mobile clinic, which is like a large orange converted RV, if you've seen it driving around, that has mammography on board to try to make it easier for people to do get screenings like that. You know, going to see your regular doctor to make sure that you're getting, for women are able to get a regular pap smear is the best thing that they can do to reduce this completely preventable disease.
And then when also it comes to men and women, colonoscopies and all of those screenings, that they have markers for certain age, maybe every year. Make sure you're talking with your doctor.
Yeah, absolutely, because your risk factors might be different, again, based on your family history, based on your age and whatnot. And there are a lot of options out there. It's not only colonoscopy, because I think sometimes that scares people away, but there are other very effective ways to screen for some of those DNA markers in patients in order to detect these things early before they become much more difficult to treat.
I think the message is don't delay when it comes to screening. Talk to your doctor if you have some concerns or fears. Just have a conversation with them. And you can always reach out to Optum. Where can they find more information?
Well, they can go to Optum.com to find more information about what we offer here in Utah.
Optum.com/Utah. All that information on our website on the Daily Dish. Thank you so much.
Thank you.
All right. Thanks again to Optum for sponsoring this interview. We will be right back with more Daily Dish after the short break.